Before the creation of Medicare and Medicaid, the healthcare landscape in the United States presented significant challenges for individuals age 65 and older and low-income individuals. Here's an overview of the healthcare landscape before these programs were established. Prior to 1966, there was limited access to affordable healthcare. Older adults aged 65 and above often faced difficulties accessing affordable healthcare services. The availability of private health insurance for seniors was limited, and when available, it could be expensive and offered limited coverage. The financial strain on seniors was tarnishing their golden years. Older adults on fixed incomes, including retirement pensions and Social Security, found it challenging to cover the cost of healthcare services. Medical expenses, including doctor visits and hospitalization, could consume a significant portion of their income. Inconsistent care for low-income individuals was prevalent and depended on where you lived. Low-income individuals and families struggled to access consistent healthcare services. Many were uninsured or underinsured, which meant they had little or no financial protection in the event of illness or injury. Because of the lack of a defined system, there was a heavy reliance on state and local charities. The care for low-income individuals was often provided by state and local charities, nonprofit organizations, and community clinics. These services were not standardized, and the quality, cost, and availability of care could vary widely from one state to another and even within states. Frequently, the burden fell on local hospitals and authorities at the county level. The fact that there was no defined system created huge healthcare disparities. Disparities in healthcare access and outcomes were prevalent, with marginalized communities facing particular challenges. Rural areas often had limited healthcare infrastructure, leading to reduced access to medical facilities and specialists. The financial burden often landed on families. Low-income families, including those with children, often struggled to cover healthcare expenses, making it difficult for them to seek preventive care and early treatment for medical conditions. This became a healthcare dilemma that needed solving. The lack of comprehensive and affordable healthcare coverage for older adults and low-income individuals created a turning point for the nation. Many people delayed seeking medical care due to financial constraints, resulting in potentially more severe health issues. President Lyndon Johnson led the writing of the legislation and creation of Medicare and Medicaid in 1965 and were aimed to address these pressing issues and disparities across the United States. Medicare and Medicaid became two of the many programs for his Great Society. The Great Society was an ambitious series of policy initiatives, legislation, and programs spearheaded by President Lyndon B. Johnson with the main goals of ending poverty, reducing crime, abolishing inequality, and improving the environment. In May 1964, President Johnson laid out his agenda for a Great Society during a speech at the University of Michigan. With his eye on re-election that year, Johnson set in motion his Great Society, the largest social reform plan in modern history. Medicare provided coverage for older adults aged 65 and older, while Medicaid offered assistance to low-income individuals and families. Medicare was funded through employee and employer payroll taxes. Medicaid was funded via federal payments provided to the state, with additional resources provided at the state level. Medicare became a federally managed program, and Medicaid, while state-managed and directed, has federal regulation that standardizes minimum requirements. These programs played a critical role in improving healthcare access and reducing financial barriers for vulnerable populations throughout the country.